All right, it being 6:30, I'm going to call to order a meeting of the Oregon School District Board of Education. It is November 22nd. We are here at the Innovation Center at Oregon High School. Before I do the roll call, I want to say a few words about what happened yesterday and want to send our thoughts out to our colleagues and our friends in Waukesha. It was an unspeakable tragedy, and it's hard to really take some of these things these days, and so they're dealing with that as a community, they're dealing with that as a school district, and so sometimes you just have to step back and think about what's important, and I really want them to know that we're thinking of them. So I just wanted to take a few moments to talk about that. Katie, can you please call the roll?
Ms. Bijak?
Here.
Ms. Garrison? Yes. Mr. Mehring?
Here.
Dr. Lakuta?
Here.
Mr. LeBrun?
Here.
Mr. Pankratz?
Present.
Ms. Flanagan?
Here. Board does have a quorum. I do have from Katie that this meeting was properly noticed. If anyone would like to look at that, she will have that here. Just talking about our agenda tonight, we do have our consent calendar, then we do have some information items which include public comment and an OEA report. Then we will move on to action items, which is policy 565, 566. And then we will have committee reports from Policy, Vision Steering, Worthwoods, and then new Heather will report on the Wellness Committee. And then Leslie, Dr. Bergstrom will have her information updates, and in that she will include some statements about the events of the last couple weeks. So that is what is before us tonight. I will entertain a motion to approve the agenda.
So moved.
All those in favor, please say aye.
Aye.
Anna, is that an aye or a nay?
That is an aye from Anna.
Okay. Motion carries 7-0. Next on the agenda is our consent calendar. I do want to mention we do have two donations. We do have $2,000 from Edwin Ferguson for the Oregon High School Band Program, and then we have $10 from Margaret Kohlberg for the Oregon Brooklyn Splash Pad. So as always, we do thank those community members for their generous donations. Are there any items of the consent calendar that any board member wishes to have removed or have themselves abstain from?
Crystal, this is Anna. I will abstain from approval of the November 8th meeting minutes as I was not in attendance for the entire meeting.
Okay. Anyone else?
And I was not in attendance at the executive session previous meeting to this.
On the 11th. Okay. So the board members will recuse themselves from those. So I'll entertain a motion to approve the consent calendar.
So moved.
I think Tim had it. So is there a second? Okay. We have a motion and a second. Katie, can you please call the roll?
Mr. LeBrun?
Yes.
Dr. Lakuta?
Yes.
Ms. Bijak?
Yes.
Ms. Garrison?
Yes.
Mr. Mehring?
Yes.
Mr. Pankratz?
Yes.
Ms. Flanagan?
Yes. Motion carries. And the minutes will reflect those abstentions. Next on the agenda is B, information items, public comment. So per board policy, speakers will have 3 minutes in which to make their comments. Ms. Katie Heitz will signal the speaker when their time is up. The board will not comment after each speaker and will reserve discussion to any items on the agenda. Speakers are welcome to stay for the meeting. And next steps may include referral to the appropriate administrator for follow-up with the speaker or placement of the matter on a future agenda. So we do have a few people registered for public comment. So when you come to the microphone up here, could you please state your name, your address within the district, and any group that you represent. First up is Josh King.
Hi, my name is Josh King. I'm at 150 Joanna Circle here in Oregon, Wisconsin. Good evening. It's a pleasure to see everyone here. Dear OSD board members, I wanted to have a discussion today about the mask mandate repeal from Public Health Madison-Dane County and the potential for future discussion here in Oregon School District. With PHMDC acknowledging the cost of mask wearing without necessarily any more tangible benefits, thereby announcing a reversal in their mask mandate, and most schools establishing a mask optional scenario months ago, I ask that you all make masks at OSD optional for students, teachers, and staff. We all know that masks, particularly N95s, worn consistently at school, at work, and around anybody else is probably the only chance you have to formidably prevent virus particles from entering through the mask. The cloth masks and surgical masks that we wear today do a poor job of that. There's not a lot of rigorous scientific data or controlled trials and studies in vaccinated or unvaccinated communities to show protection when worn correctly. Now, we all know these aren't necessarily worn correctly at school or in most other areas. So we have to use prudence and evidence to see that masks have done very little to stem the infection of COVID. And this is evidenced by a fantastic data stream that we've been looking at for the past 10 to 12 months, showing that a lot of school districts with mask optional versus masks have very, very similar infection rates, very similar hospitalization rates, and very similar death rates, which are almost zero for the latter. With vaccinations up and hospitalizations very, very low in Oregon, the ultimate question is, can we provide parents, students, and teachers with the freedom to wear a mask if they like to do so? Others who don't want to, who perceive the fear or perceive the risk of infection so great that they desire to wear masks, are welcome to wear masks and should be done so and allowed to do so with freedom, the same freedom that we all want, especially with if your child or your family are vaccinated or have had COVID. Parents realize that teachers, board members, nearly all of our community go without masks for the bulk of our activities. And there's, we see each other at the ball games, we see each other out in town, we see each other in restaurants, and we say hi, we hug, and there's no reason that shouldn't be the same philosophy here. We're happy to make some of those, any of these experiences knowledgeable to your staff if that is necessary. Maintaining a mask mandate for students in schools provides very little protection. And now that vaccinations are available, I think masks will continue to limit the critical interaction between students and staff. And in general, controlling everything you can isn't the greatest style of leadership. Controlling only what you must is the leadership philosophy that truly works when there's so many educated parental stakeholders involved. I truly hope that OSD leaders understand that extending the mandate means the most burdensome path for all involved, while the perceived protection it provides
Mr. King, your time is up.
Thank you. Parents, students, teachers have the same right to wear a mask or not to wear a mask, and OSD should recognize that as many others have done. Please do not extend the mask mandates any further. Thank you.
Great, thank you, Josh. Next up is Robert Head.
Good evening. I made the decision tonight to wear a coat to this event, not because CNN told me I needed to wear a coat every single day for the rest of my life, or because Fox News told me that coats are ineffective and don't do any good keeping me warm. I wore it because it was a simple decision. History tells me it's November in Wisconsin, it's going to be cold, I need a coat. The data tells me it's 30 degrees out, I need a coat. Again, it's a simple decision. That's as simple as the strategy needs to be in regards to masking our students and staff. For the past 20 months, I have listened to people on both sides of the mask debate speak with fear, anger, and entirely on emotion. Very rarely are data or facts used to support an argument. We've all been in fear. We're all frustrated. Enough is enough. It's time to eliminate emotion. It's time to eliminate fear and political agendas and put an end to these redundant town hall forums. It is time to start using common sense and data to determine our course of action. COVID-19 is likely not going away, and it's time to manage this virus, not fearfully wait for it to vanish. I'm not here tonight to ask the board to go to strictly mask optional. I'm not here tonight to ask the board to go to strictly mask mandates. I'm asking the board to adopt a data-based strategy to determine the masking policy at each school. This is a very simple strategy that has been successfully adopted by school districts throughout Wisconsin. The advantage Oregon has on all of these schools is our incredibly high vaccination rate. It's very simple. If cases are X or higher in a building, we mask up. If they're below, masks are optional. I asked the school board to reference the School District of Jefferson COVID-19 dashboard, which gives a very simple process plan for masking, contact tracing, and quarantine requirements. This strategy creates a scoreboard for all of us to see and adhere to. It removes the burden on the board to continually have to deal with this issue. It brings down the temperature in the room, and it creates a center point for everyone to respect. I ask that this strategy be put in place beginning November 29th for our middle and high school students. For our students in K through 6, this strategy would be put in place on January 10th, or when a reasonable percentage of those students have completed the vaccination process. I realize that doing this could cause extra work. To assist in implementing this strategy, I would be willing to offer my time and services to create simple, easy-to-read communication tools to share with our staff, student, and parents. It is time. It is time to let data determine our course of action. It is time to replace fear with calmness and emotion with facts. Thank you.
Thank you, Mr. Head. Next up is Ildi Martin Fee.
Hi, I'm Ildi Martin Fee, 562 Concord Drive here in Oregon. I'm a family physician, and I've been taking care of patients with COVID throughout this entire pandemic. I will tell you it has been tough, and I will tell you let's hold out just a little bit longer with these masks. Let's get these kids fully vaccinated. Let's reassess in the new semester. I think folks have been very patient. Folks have been making some common sense decisions. And we just need to continue using that common sense just a little bit longer together with that data. That data shows that cases of COVID have been going up these last few weeks. That's not great. I will tell you over the last several weeks, I've had to call and tell many patients that they have COVID. Some of them are really dang sick. Some of them aren't, but they are still trying to figure out what the heck to do with their kids when their kids are then out of school for 10 days. We all remember where we were a year ago and how horrible it was, how our discussions at that point were, can't we go back to school? Can't we go back to school? We're back to school. Let's keep our kids in school. And our best bet for doing that right now is to just keep the masks a little bit longer. Thanks.
Thank you. Next up is Sarah Kissling.
Good evening. I'm Sarah Kissling. I live at 840 Mary Hill Drive. I am a community member, I'm a parent, and I am a teacher at OHS. And with Thanksgiving quickly approaching here, I just wanted to come tonight, and I wanted to express my gratitude to you, Leslie, to you, Jim, and to the board for everything you have done with the intention of keeping all students and staff safe as we've returned to school. Obviously, hindsight's 20/20, and we probably won't know if we did things right until, a long time from now. But I really believe you have acted with the very best intentions for all of us. And in a time when a decision is made in which someone doesn't agree with you is met with public attacks on your integrity, it is even more important to say thank you so much for all that you have done, and to remind you that students and staff do appreciate it. It doesn't go unnoticed, and we see you. Thank you.
Thank you. Okay, that is all we have on the list for public comment. Is that correct, Katie? Okay. All right, moving on. Thank you to everyone who came and spoke tonight. We appreciate it. We appreciate hearing from you. Next up is OEA report. Are Nathan or Laura here for an OEA report? Okay. All right, moving on to C, action items. So here's what I'd like to do tonight. Dr. Bergstrom is going to give a presentation. After she is done, I would like each of the board members to see if they have any clarifying questions. We've got plenty of time to discuss this. The first thing that we're going to do is ask any clarifying questions. After we're done and people are satisfied that they understand, then we'll move into, I will entertain a motion on the floor. Okay, is everybody agreeable to that? All right, we'll start with Dr. Bergstrom. The floor is yours, Leslie.
Thank you. Good evening, everybody. Whoa. Here we go. So you've seen this graphic before. It's our plan about how we are bringing us all back together for 21 and 22, and what we plan to, or what we are prioritizing at this time. Oh, there we go. Which is, of course, mental and physical wellness and high-quality teaching and learning. We've been very clear from the beginning that our Back Together plan has a goal. And it's a goal of safe, in-person learning, keeping our students in school with minimal disruption. And now that we are to the point where we're talking about how to actually consider rolling back or peeling back or unwinding, whatever term you want to use, one portion of our layered safety strategies, I think we need to make sure that we are considering all the factors that are a part of that decision. So, if we're starting, and you saw this the last time that we were together, if you're starting with our goal, which is students in school with minimal disruption, well, we know the county mask mandate is anticipated to end on November 27th, not very far away. We know that the OSD safety policies are working, and universal masking continues to be strongly recommended by local, state, and national experts, and we'll talk more about that in just a moment. You know that vaccines are now available for ages 5 to 11, and it takes 5 weeks from the first dose to be fully vaccinated. We did hold a clinic for the first dose on November 19th, and the clinic for the second dose will be on December 12th. We had 450 students attend the clinic. So, as our student vaccination rates increase, that's when we know we can consider peeling back one other layer of strategy. Because while the health organizations from multiple levels, as local as UW physicians, all the way up to the CDC, are all saying the same thing, it's the layered mitigation strategies that work. But as you're increasing one, you can consider pulling back on another. So as our vaccination rates increase, now is when we should be considering pulling back on the masking requirement. We also know that a mask optional, or as some of the professionals have encouraged us to refer to it, a mask strongly encouraged environment, will result in more quarantines, particularly in those who are not vaccinated. And that currently, Dane County is categorized as very high activity, and cases are increasing. This is important to note because the last time we were together at the last board meeting, we were in the high, and we were hoping that actually by the time we met again, we'd be in the medium. And instead, we went in the other direction. So the board has taken a very active role in ensuring that we are reaching our goal, and they passed policies 565 and 566. You can see the policy was originally adopted in August of 2020, and it was revised in August of 2021. Where the protective measures we use within the school district should be in accordance with guidance from listed public health and the CDC and other local, regional, and national experts to provide broad data points. So, knowing that, we need to be able to provide broad data points, and we should be looking at multiple experts to do it. Here's how this lays out. Currently, the CDC, the American Academy of Pediatrics, the Wisconsin Department of Health Services, Public Health Madison-Dane County, and the UW Health Department of Pediatrics are all giving the same advice, which is they're recommending layered mitigation strategies that include universal masking regardless of vaccination status in schools. So what are those layered strategies? Vaccination for those eligible is probably the number one strategy in the eyes of the health experts. Universal indoor masking for K-12 schools regardless of vaccination status is another layer. Maintaining at least 3 feet of physical distance to the greatest extent possible is another layer. Symptom screening, ventilation, hand washing etiquette, staying home when you're sick, another layer. And finally, testing, contact tracing, and quarantining is another layer. And I know that there are some people who are very interested in why can't we consider peeling back quarantining as the first layer that we consider in our strategies. Well, public health has been very clear on that recently in order to make sure that school boards and school superintendents understood where public health stood on that issue. I'll just read a quote so you know what I recently received. To be clear, schools cannot redefine quarantine or close contact or declare that they are ending quarantine for individuals. These are public health terms that have implications beyond the school setting. Schools cannot say to someone who knows they were exposed to COVID-19 that they do not need to quarantine. They do. So that is public health trying to be very clear about what's within our purview and what is not. So we know what the health experts are currently telling us, and that's a part of 565 and 566. So then let's look for a moment at our data. And as referred to earlier this evening, the data is excellent. 80% of our OMS students are fully vaccinated. 77% of our OHS students are fully vaccinated. Then we shared with you last time, 99% of our professional staff have reached that status. And when you look at the number of students, 449, who participated in the vaccination clinic last week, just that group alone would indicate that 22% of our students aged 5 to 11 will reach the goal of full vaccination. And then knowing too that many households within our district have those who are eligible for vaccination and those who are not within the same household. And we also know that the majority of the transmission within the school district was household transmission. So we thought it would be important for us to at least consider how many households have children in both K-6 and 712. And that's really hard to calculate because people and situations can very much vary, but that's about 19% of our students. So, since the beginning of the school year, we've had 137 positive cases in the student population. 137. Now, because we were a universally masked environment, and you can see the little 4-quadrant piece on the bottom, because of the fact that we were universally masked, we only ended up needing to have 36 quarantines that were due to being a close contact at school. And what that really meant, and by the way, when you look at other people's numbers, they're in the hundreds. So this is really good. We don't want any, but 36 is still a pretty decent number. It came from exposure at lunch because students have to take their mask off at lunch, right? Even though we keep the younger ones 6 feet apart, that isn't necessarily the case when they get older. We encourage it, but they're not sitting on little smiley faces the way that younger ones are doing during their lunch period. It can come from wearing your mask improperly in the classroom. So really, it's mostly about masking. We have done very little quarantining of close contacts within a classroom because our students are by far and away masking, and they're doing it well. So, if we're thinking about universal masking versus masking encouraged, we have to look at it and make sure we understand exactly what it means. So, in universal masking, if both people are wearing a mask, as is required currently, a close contact would not equal a quarantine. Excuse me. In a masked encouraged environment, vaccinated students are not required to quarantine unless they're symptomatic, but vaccinated students would be required to quarantine if they were a close contact. Another thing to remember is that the 3 feet, being able to be 3 feet apart and not being a close contact, that was only for universally masked classrooms. If we peel back that strategy, as we all intend to at some point in the near future, as we peel that back, close contact definition reverts to where it is everywhere else, which is 6 feet instead of 3. I also want to point out, and I think this is important to remember, that the idea of vaccination, people who are vaccinated only quarantining if they show symptoms, and students who are not vaccinated only having to quarantine, those are not Oregon School District rules. That is coming from the CDC, Wisconsin Department of Health, and our local public health agency, not from the school district. So if you see how it looks large picture, now let's look at it as an example. And this is important to think about what it's like for a student in a classroom. So let's just think of this through the lens of someone at the high school, for example. So a student comes to school, they only have one symptom on the Panther Pledge. So they come to school and they go throughout their school day. They eat lunch, maybe 6 feet apart, hopefully, but perhaps not. And then at night they start to feel worse and they get a test and they find out that they indeed have COVID, which has happened to many, many, many of us over the course of the last year and a half. Universal masking, in that scenario, no additional students or staff would be required to quarantine unless they were symptomatic. When we go to a mask-encouraged environment, anyone within 6 feet of the student who was positive that day in school or activities would need to quarantine if they were unvaccinated. Now, so let's just think through what that actually means. Our students aren't sitting in desks all day long, but let's just pretend that they're sitting at a desk every single class period. So that would mean 4 close contacts. So the desks are 3 feet apart at best, right? They're not 6 feet apart. So it'd be 4 close contacts per class, times 8 classes a day. That would be 32 people within the school system who would be designated a close contact. So 75% of them were vaccinated, and that would just be average, and I'm doing that for easy math. That would mean potentially 8 people would need to quarantine due to 1. Now remember, we've only had 36 quarantines all year so far, so that's an increase. Now, when the community transmission rate is low, because we reflect the community transmission rate, when the community transmission rate is low, we will have fewer cases in school. And there will be fewer people who would be required to quarantine in this masked encouraged scenario. However, unfortunately, since last week, we are not in that place anymore. If you look at the green bars on here, you can see where we were on August 22nd, and you can see that compared to where we were on November 14th. We've gone from high to very high. And if you look at the categories down at the bottom in counties, we went up again. We were one of the few in the high category 2 weeks ago. So I think we all want to be able to take that next step. It's important. It's something we are all committed to. And it's helpful to think about it as how we're moving forward, because we've done really well thus far. When we've made a decision and we've moved forward in a safe, and I'm sure in many people's opinion, much too cautious of a manner, but we've moved forward. And we have not quarantined classrooms. We have not had to close schools. We have been able to move forward and keeping our students in school. So we know that that is still our goal. So it's going to be about timing. So when we decide that we're peeling back the next layer, we have to understand that there may be more transmission in school, more close contacts in school, because we're going from 3 feet to 6 feet, much wider range, right? We will have more students missing school and activities, especially if we haven't given the case counts enough time to come down. And this does impact our staff. And that's something that's really important to note. First of all, they're people who have families. And their families have been through these situations where their children have had to quarantine also. And so then someone from the family, oftentimes one of our employees, needs to stay home while their child is quarantining, because case counts are still high and these things are still happening and kids are still needing to go home, or daycares are closing, or whatever the case may be. So not only do our staff have personal challenges navigating this with personal illness as well as family illness, but then the more students that you have absent, the more you have to prepare for the students who are there and the students who are not there to ensure that they continue to get as much instruction as possible. Now, I think that this is something that we need to do. We need to be able to move forward. We need to be able to move to a masked encouraged environment. It's about when do we do it, so we're minimizing the number of students who are missing school and minimizing the number of staff who are already at their absolute maximum, and then we're asking for more. So here's what administration would recommend at this time. We would like to be able to move to a mask strongly encouraged environment for all students and staff, because we would say that our students and our staff, the policy should be mirrored, starting on January 18th, because that gives students in the ages 5 to 11 enough opportunity to be vaccinated. It decreases the possibility of transmission in schools for cases that have been contracted over the holidays. There's a lot of travel that happens. That's a good thing. It's finally time where, and especially for families who are fully vaccinated, to be able to see one another. That's a great thing. But we also know that it may lead to a week or two post the holidays where we're seeing an increase in cases and consequently an increase in the number of students who miss school. January 18th would also allow the board an opportunity to have their January 10th meeting and to look at the current data. Now, we are all predicting, of course, that the numbers will be significantly lower by then because of the increased number of students who are vaccinated. You increase vaccination percentages in the community, and spread goes down. So that's what we would expect at that time. But this would give the board an opportunity to discuss that. However, if members of the board would prefer a phased approach, then the recommendation would be that we start our first group 1 week after winter break, to allow for, as I said, cases that have led to transmission or holiday travel that may have led to cases to not be transmitted within the school. And then 2 weeks later, follow up with our K-6 on January 24th. I know we've done many things in a phased manner. There are some advantages to that, but it would really be what indicators would we be looking for to either go forward or not go forward with K-6. The CDC has an order that requires masks on school transportation. That's important for us all to remember. And then we also recommend that beginning on November 27th, masks would be strongly encouraged while actively playing or performing during optional events. Participating in a winter sport is optional. So a mask encouraged but not required while on the court or on the mat, whatever it may be, is something that I think a step we can make, and we can certainly get some data related to transmission there also, as well as optional events that are about performing. Our students in a concert, that's a required course expectation. So that should have the same expectation as any classroom. However, there are performances in our Performing Arts Center that are optional and not required. And consequently, they should be subject to the same rules as sports in that situation. So that is where the administration leaves it, and now we are open for questions.
All right, so we will have give everybody the opportunity to ask any clarifying questions of Dr. Bergstrom. So I will open the floor to see who would like to go first. Go ahead, Heather.
We're just doing questions right now, right? Okay, so I just have a couple questions. Dr. Bergstrom, thank you for walking us through that. My first question is back on the quarantine piece. I just want to make sure I've got it right. Yep. Okay, so I know you said we have to follow the CDC and Dane County, Public Health Madison, Dane County. Can you just help me understand what is the ultimate? Is there one that we're following, or is it all of them, or are they all? But I guess what I'm just trying to understand is, I understand that we have to follow it. I'm not disagreeing with that. But how do we know at a point if they ever diverge in their opinion? What is our ultimate?
They haven't always said the same thing.
Okay.
And when they do, we have reverted to the most local organization.
Okay.
Because they're relying on our local.
Yep, perfect. I just want to clarify that. And then, so just so I'm sure that when you are not vaccinated, you have to quarantine. If you are close contact, but the close contact is getting, it's a bigger.
Expanding without a universal masking requirement.
Gotcha. So for the most part, most people would, in the classrooms, we're not 6 feet. We have no ability to go 6 feet. Is that right? So then there will be close contacts, but if you're vaccinated and you don't have symptoms, okay. Got it. I know I'm repeating some of this. I just want to make sure I've got it right
I think
here.
there's one other point, though, sorry to interrupt, is that if you have had COVID, you are considered the vaccinated, no quarantine. Is that correct, Dr. Bergstrom?
It is for 90 days.
90 days.
Yes.
And thanks, Krista, because the other part is the vaccination is until the CDC, now we're dealing with boosters and whatnot, until the CDC says, or Dane County Public Health says, X time is up, you're still vaccinated. That's not that 90 days. That's only for a positive COVID case?
That is correct. 90 days is only for a positive COVID case.
Okay. And then I wrote myself a note that said slide 12. See if I remember what I had it. That was one of the few that had a number on it. So, oh, thank you. There we go. There it is. Okay. Yeah, I think you answered my question. All right, that's all I have. Oh no, the other question I do have is 4K. So we're talking a lot about K through 12, and I just wanted to hear.
So 4K would follow the same rules or the same safety strategies that we follow in the K-12 setting.
Okay.
Our 4K class. Thank you, Mary. Our 4K classroom would follow the same safety requirements that we have in the K-12 setting. However, when we do peel back and we decide to go to mass encouraged, then we would allow the 4K sites to set a more stringent requirement if they so chose, especially since the people there many of them are not able to be vaccinated.
They could follow our.
They would be expected to until we peel back the mask requirement, and then if the site would like to keep it, we would honor that.
Got it. Okay, thank you. That's all I have for questions.
Okay, who would like to go next? Kevin?
Thanks, Leslie, for the update and presentation. I guess a couple questions that I have here. When a student goes on quarantine, what learning options have we provided them, or are we able to provide them?
Great question. So for K-6, we do live streaming in the classroom. And for 7-12, we keep Google Classroom updated, and students are working independently through Google Classroom. 4K has been the delivery of hands-on learning activities for when the student is out.
Okay. And the students in 7 and above that have Google Classrooms to learn basically independently, I suppose with parent assistance as well, do they have the ability to contact their teachers and be in get some, I wouldn't call it instruction, but at least ask questions?
Oh, absolutely. Our teachers have done as much as they possibly could for the students who had to be home.
Okay. The quarantine deep dive that you provided was certainly helpful. Can you? I mean, I've obviously been reading a lot what has been going on with local school districts and the decisions they've made, but maybe you could describe what you've seen, and obviously without mentioning the school districts, but I'd just like to see what flexibility, because the mask policy, as we're speaking about quarantine in general, is of course linked to the quarantine policy. So what have you seen that other school districts have done? Because you made the comment that it's not negotiable, but meanwhile, school districts are
You are right.
doing what they want to
So
do.
I think we're going to be seeing in the next few weeks what exactly that means. So I think after one Dane County district made the decision, or a board I believe it was, made the decision to end quarantine for symptomatic people, that's when public health sent a letter to superintendent saying that's not in your purview.
Right.
So that's how that has rolled out. Now, will there be additional districts who decide that they're not following what public health is instructing as a requirement? I guess time will tell. It is a strategy that can eventually, I do believe that we will be peeling back. It just wouldn't be the first one, especially when public health is saying, do not do this.
But the one you mentioned that I'm aware of as well is pretty extreme, meaning even if you have symptoms, you don't have to quarantine. Is that what you just said, or did I misunderstand?
Even if you have symptoms, you don't have to.
Was it symptomatic
if you are
students?
not, yes. If you are vaccinated,
Okay.
if you don't have any symptoms, then you just keep going to school. That's not a problem. It's when students are unvaccinated that public health has said you must quarantine regardless of whether you have symptoms or not.
Which is a whole other topic in terms of vaccinated or unvaccinated students and people transferring. So we can discuss that later. A couple other questions I have here. You made the comment that close contacts have occurred primary lunch areas. How do we know that, I guess, number one? Is it just primarily because they're not wearing masks, so that automatically falls in that chart?
Well, we do contact tracing. So we have people who specifically call and talk to either the parents of, or in some cases with parent permission, the student, and are able to think about who were you with? Were you wearing a mask? Were you not wearing a mask? That sort of thing.
Okay, but the fact that they actually didn't have a mask on is what makes it a close contact, because based on the chart you showed, the cute little smiley faces, it wouldn't apply. Okay.
Exactly. Or there were times, I think there was one time I can remember where the teacher said that the students involved were not wearing a mask properly.
Okay.
Consequently, it led to a close contact.
Okay, last question. What data, or maybe the better term is learnings, do we have from other school districts in the state? And I think of Waukesha County, that's the popular one that has not had mask mandates for several weeks now. And I have relatives live there. I mean, I'm sure it's happened from time to time, but has there been mass quarantine issues with these districts that have had mask optional policies for several months?
They've certainly had way more than 36.
Okay,
Yes.
but we don't have data or learnings from those districts on what's happened with.
No, because most of the dashboards, as a matter of fact, we were looking around today. Most of the dashboards just have case counts, and not the number of students quarantined. Although we'd certainly be interested in learning more about that, but we don't have that information right now. Also, there are some schools that are not doing that. They're not quarantining. Period.
Yeah, you would hope school districts would be sharing this information so we can learn from each other, but it sounds like that's not readily available.
Well, the ABC Collaborative does. Remember I mentioned that a couple of times? That's all of the school districts that have agreed to participate in the study from Duke and UW-Madison all around the country.
Sure.
So we do have data related to that.
Okay. That's all I have at this time. Thank you.
All right, who'd like to go next? Tim, go ahead. Anna,
Thank
then we'll
you.
go to you.
Thank you, Leslie, for putting together all this information. I really do appreciate it as well. I'm learning every day about this. It's an evolving education for me as well. Do you know today how many students we have out because of COVID today?
This week, I believe it's 19.
So
Can you look that up?
19.
Is that right? 19, yeah.
So that's 19 of which number? 19 of the 36 or 19 of the
No,
much
how
higher
many
number?
positive cases we currently have is 19. So that's 19 across the students within our district.
Okay.
The 36 is the number of students who had to quarantine because they were a close contact
Okay, very good.
throughout
All
the
right.
whole year.
All right. Have we ever had a student, from your knowledge, have we ever had a student hospitalized due to COVID?
Not from my knowledge, but I don't know if I would know that, but no, not that I know.
Okay. And the positive cases that you mentioned of 36, about 1% have gone on quarantine because of close contacts at school. Is that right?
You're saying it's 36, 1% of our total
Yes.
population?
Yes.
Yes, it's even less than that.
Okay. And I'm just floored every time you bring up the vaccination rates. 77% at OHS, 80% at OMS, and rising, I would imagine. Staff at nearly 100%. And certainly the younger group now ramping up, and certainly having the clinics here is a big help. And I've heard that from a number of people. Are you aware of negative effects of masking? Have you had reports of negative effects of masking?
Certainly, there are certainly emails that come in from families that tell of things that are negative related to masking and ways that masking negatively impacts their child. Absolutely.
So things like breathing issues or face, breaking out on their face, things like that, the things we hear about in general.
I don't recall hearing of any acne due to mask wearing, but I can certainly see how it can happen.
Okay.
As far as other issues that parents bring forward, of course. And that's when we encourage people to go to their doctor, and if there's a medical excuse, we'll find ways to ensure that we are doing whatever accommodations are necessary for their child.
Okay. That's all I have for now. Thank you.
Anna, we're going to give you an opportunity to ask clarifying questions if you want to.
Great, thank you. Yeah, I just have a couple. One was kind of touched on, but I just want to make sure that I fully understand that when it comes to the decision-making for quarantines, that it's in addition to students who are vaccinated, we're also looking at students who may have had a positive COVID infection and are within 90 days of that. So we are accounting for natural immunity that is, in a person's system, I guess, from having been infected. I just want to make that very clear, that that's an additional piece that we're using to determine those quarantine decisions.
That is correct.
Okay, thank you. The other question I have is, I have a question about the start date that you are recommending at this point of January 18. I guess I'm just wanting to clarify if this date is assuming a certain level of transmission in either Dane County or within the Oregon community, or if that is not really part of the decision-making for this particular recommendation.
Thank you. That's a good question. In that situation, we're assuming that we will see a drop in January, that as we see cyclical surges, we will see a drop. And we also believe that we will be avoiding any increase that comes from the holidays by maintaining the mask requirement just slightly beyond that.
Okay, so I guess taking that a step further, if we see transmission rates continue to be in a very high scenario, then this may be a date that is flexible and needs to be potentially reevaluated based on the current situation in January when we return from the winter break.
That's right. The January 18th date for moving to masks encouraged allows the board to meet one time post-winter break to be able to take a look at the data and ensure that's still the decision that they want to make.
Okay. And then one other, I guess, question I have with regards to the co-curricular and the optional activities. The recommendation is to strongly encourage while actively playing or performing, but that it's required for spectators. I just wanted to, I guess, clarify how that works from the standpoint of a visiting team coming to our school. I assume we would just continue with having masks available at our front door and signs to indicate that we are a mask-required venue. Is there, without an emergency order in place, I'm just a little concerned about how that works with our school. Is there anything that we need to think through related to that?
Well, just as we would abide by the masking requirements of any school district that we went to, we would expect that people would abide by ours. However, we are not going to be able to go through the stands and police whether or not visiting parents are wearing a mask. That is not what we're going to do. We're going to ask people to respectfully and responsibly follow the rules that we have for our building, but we're not going to be sending our associate principals or event supervisors up in the stand to chastise parents from a different district. That's just not where we'll go.
Yeah, and I think that I agree with that. I just feel like that could become a confrontational situation that we don't really want to put our staff in. So I can appreciate that perspective. So thank you for that. And really, those are my questions at this point in time.
All right, thank you, Anna. Mary or Troy, who'd like to go next?
I'll go. Leslie, I think I just have one question. If you could go to the slide with the options, please. So, I mean, my assumption is that we don't need a lot of time to go to a mask strongly encouraged situation. So, between these two options, do you need a certain amount of time for the board to make the decision between these two options prior to the earliest date, which would be January 10th? Or is that something that could be made a few days before?
Well, if we have the 7/12 starting a mask encouraged environment by January 10th, then we would need to have that decision before the January 10th board meeting. But of course, those are just dates that I put out because I think that if we're doing a phased approach, the only advantage to it is to be able to measure the impact. And one of the things that has been recommended to us from the doctors in the ABC Collaborative is anytime you are peeling back a mitigation strategy, to give yourself 2 to 4 weeks for data collection and analysis before peeling back a second. So I'm assuming a phased approach, the purpose of it would be for us to examine the data that comes from 7/12 being mask optional. And so we want at least 2 weeks of data to make that decision.
Okay, that was my only question. Thank you.
Mary?
Thank you. So one, I have a quick follow-up to a question that Tim was asking. And I think I misunderstood or, so we had 137 positive COVID cases in our students since October, and that represents, by quick math, roughly 3.4% of our population. And so then, but we've only had 0.9%, so just under 1% actually had to quarantine.
That's correct.
And do we have any estimate of what neighboring schools that don't have a mask requirement, what their numbers might be?
No, but I think I'm going to refer once again to the ABC Collaborative study because that's when they were referring to, or they were studying the primary infections or infections that happened outside of school versus secondary infections, the infections that happened because of transmission in school. And in that study, we had the highest rating in the country where it was 91 primary infections before any one secondary infection. So I think that our ability to keep transmission out of the classroom is reflected in the low number of quarantines that were required throughout the school year, because we've been able to keep students with masks on. Masks on is leading to no cases of secondary infection, or very few, I should say.
So then, I know your presentation was focused on our students, which is appropriate, but I think we also have to take into account our educators and our staff.
Absolutely.
So I assume the 6-foot quarantining would also apply to our educators as well as our staff, correct?
It does, and we know that our staff, particularly the staff that work with our youngest learners, they're not staying 6 feet apart. So more staff absences could possibly be the result of a mask-encouraged environment. But if the community transmission was low enough, then perhaps it wouldn't, because we would have fewer cases in the school to begin with.
I know you showed the vaccination rate in the younger students based on just our in-school vaccine clinic. Do we have plans to get the numbers in the near term, or will we have them by January 10th?
We certainly do think we'll have them by January 10th because they're pulled from the Wisconsin Immunization Registry into Infinite Campus into a tab that only our nurses can see. So we just need to allow the Wisconsin Immunization Register to be able to sort of speak to Infinite Campus. And right now, all the data isn't ready for transfer.
And then my last question for you is, has Public Health Madison-Dane County discussed removing their recommendation for universal masking in schools?
They have not. They have not. So us peeling back this particular layer would be probably our first step away from the guidance of the health officials. However, when we started talking about it 2 weeks ago, it's because we were in the midst of what we thought was going to be a decline in cases. We have to be considering our local data, and of course, we have to consider our fantastic vaccination rate and how that plays into our decisions.
Thank you.
All right, thanks everybody for the clarifying questions. So now what I'd like to do is we can move into someone putting a motion on the floor if they so choose. What I'd like to do is request that we all follow parliamentary procedure. So like we did last time, we'll have some lively discussion. The person that will make the motion, and if they get a second, and then we'll engage in discussion back and forth. I will not be going around the room. People can ask for the microphone and then they can speak. So right now I will entertain if anyone would like to put a motion on the floor.
Clarifying question maybe for Gina. Do you want discussion before the motion, or you want the motion on the floor so we can discuss? Okay, and I can start with discussion right after the motion.
You can make a motion, then if we get a second, and then I will ask for discussion.
Okay, just wanted to confirm. Yeah, so I'd like to put a motion forward. So it's complicated, right? We have our policy 566, the protective measures, and then we have the administrative guidelines, which is a long list of very detailed guidelines, including how we sneeze and how we cough, et cetera, et cetera. So it's a little difficult to have a concise motion without going through the whole thing. But to make it simple, I'd like to propose a motion that adjusts and simplifies administrative guidelines and policy 566, the COVID protective measures. All staff and students, including 7th grade and above, will move to mask encouraged beginning Monday, November 29th, for all school and all extracurricular activities. Also related to the mask mandate, all students 5 through 11 years of age will be required to wear a mask until 7 days after the start of school in calendar year 2022, which means January 10th, I believe, where it will become mask encouraged as well.
All right, just to make sure, Kevin, why don't you go ahead and repeat that one more time, and to make sure that Katie has the motion?
I can, yes. I can email it to you.
So what I understood as your motion is that beginning Monday, November 29th, that the Oregon School District would move to a mask optional environment for grades 7 through 12, and then beginning January 10th, that environment would be a mask optional for grades 5 through, or sorry, K through 5, K through 6.
Yeah, thank you.
Sorry.
Yes, that's correct.
All right, is there a second?
Second.
All right, we have a motion and a second. I will open the floor for discussion. Kevin, go ahead.
Yes, thanks. I'd like to discuss this here with a few facts. So, you know, originally I planned, I've been doing a lot of research, as we all have been. We're all inundated with data, you know, some more reliable than others. Of course, we know that PHMDC has finally stopped with the emergency orders on mask wearing. So they've made a statement. We followed their policies to a T to this point. And, you know, they haven't changed. I actually was expecting they might this week, but they haven't. So they've made their statement that mask strongly encouraged is their recommendation, because otherwise they would have made a different recommendation this week. We've said many times we have extremely high vaccination rates in Oregon, let alone Dane County, much higher than some of the other districts in other parts of the state, let alone country, that have been mask optional for several weeks, some months. We've had a long time to get vaccinated. I actually did the math today. If you're 16 years and older, you've had 231 days to get fully vaccinated. So that's since April 5th in Wisconsin. If you're 12 to 18 years of age, you've had 193 days to get vaccinated. That's as of May 13th. The 5 through 11 years of age, of course, we haven't had much time for the young children and the parents that have decided that vaccination makes sense for them. That's only been available, as we know, since November 8th. So thus the difference in terms of the recommendation on when we'd go to mask encouraged. We're doing similar to many districts around the country and around their state that have mask mandates, again, that have not been in place to the extent they have been here, with much lower vaccination rates. This is a fact. School districts 45 minutes from here have been mask optional for many months. That's a redundant statement, but important to make. And to my knowledge, their schools are not being shut down with massive quarantines. Of course, they're having them, as are we, but they're not dramatically disrupting school. Cases will not go away. We need to learn to live with this virus and allow people and parents to make personal decisions. Parents should have that ability. It's past time for that. So it's time to move on and allow freedom of choice. And again, we've had ample time to get protected. Parents should have the choice that they will deal with the potential quarantine situation if they decide to come to school without a mask. And I appreciate you considering this motion of moving forward and adjusting as we learn more.
Great, thanks, Kevin. Who else would like to have any comments or discussion on Kevin's motion? Go ahead, Heather.
I'm going to back up for a second. I always try to start with the positive, and I just wanted to first pause and say thanks to the staff and the volunteers and the administration who made sure that the vaccine clinic was possible. That is above and beyond what is required of a school district. Many people on both sides of the coin have spoken about what role the school plays in children's health and decisions and families and what it doesn't. And I just think that is a testament to what an important role that the school does play. The fact that we just were able to vaccinate 421 children with volunteers and staff is amazing. So I just want to start with that. This is really complex. People have reached out on both sides of the coin. I'm grateful for all the parents and the community members have reached out on all levels. I don't think it's as simple as a personal choice. We all wear pants for the greater good, and so I don't think that masks are necessarily a personal choice as it affects other people. Having said that, I'm not a scientist, and throughout this pandemic, I've never claimed to be one or wanted to be one, and I look to PHMDC and other experts on how we do that, and so I agree that the November 29th start date is valid. It's hard for me to pick a different date than that, but I'm not ready to do 7 through 12 all at once. On the flip side, I appreciate that we're following PHMDC's quarantining rules, because we can't live in this world where some schools are saying, oh, we're not going to follow that. I think we either need to pick a lane and stick with the guidance, or we're not. It can't be both ways. And so it's important to me that they're changing their language from mandating a mask to strongly recommended. So that's where I'm at, with starting to mirror that language. And I think strongly encouraged is a good way to put it. I think vaccinations matter. The rate matters. The time that kids have had to do that matter. And like is not a great word, because nobody likes that we're here, but I think quarantining puts the onus on families having their kids vaccinated, right? It is not our rule, so we're not able to make that change if we're going to, end this mandate along with Dane County Public Health. So I am for a phased approach. I would not support Kevin's motion. I don't know if now's the time to make a friendly amendment, or we need to go all the way around. Okay, I would like to make a friendly amendment. Go ahead.
Gina would just need to deem if it's a friendly amendment.
yeah.
So go ahead, and then she can.
You tell me if I'm friendly or not. I would like to make the friendly amendment that we would start with 9 through 12 on November 29th. Hearing this phased approach is 2 to 4 weeks, then I would want to go 7 and 8 after break. So what is that, January 3rd? And then I guess that would be January 24th. I had originally in my mind set it semester break at January 18th, but I agree that the 2 to 4 weeks is valid, so January 24th through K through 6. Is that friendly?
As parliamentarian, I would tend to say no, unless Kevin and then Tim agreed as the maker and the second.
You're very friendly, and it was rather friendly amendment, but I can't accept it only because there's really no logic to separate 7th and 8th graders from 9th through 12th graders in terms of when it's implemented, so not friendly.
Okay. You can still discuss.
I'm just going to discuss, but the reason that I think it is because Yes, sorry. I'm concerned about testing out what happens, and so I'm looking for the smallest. I guess the smallest population would be 7 and 8, but I'm trying to find a way that we can make sure that we're not having massive disruptions. I'm still for the keeping kids in school safely and consistently, and staff as well, and I'm really concerned with our staff shortages as they are. So I'm just trying to find a way to narrow it, but yet move us along and have a plan in place. I just normally am for ripping a Band-Aid off, but I don't think that this is the time to do it when we're already in flux. So totally get that I'm friendly, but my amendment is not. So I will pause there.
All right, I'm going to give Anna a chance to jump in because we can't see if she has her hand up. Anna, do you want to have any discussion associated with Kevin's motion?
Yeah, I guess my my thoughts are that it seems I don't agree that we're at the right place to start peeling back layers of our mitigation strategies. Back in August, we met, August 9th? I looked back to see when it was that we reviewed these policies leading up to the upcoming school year, and at that point in time on August 9th, we expanded that policy to allow us to increase the number of, organizations and health experts that we were going to rely on to give us broad data points. And that was a unanimous vote to support that change. And at that point in time, the recommendation from the administrative team was to require masking for all K through 12. At that point in time, there was no emergency order in place. And so I feel like today, when we're talking about this, it's really no different of a discussion than we were talking about in August, with one change, and that is the emergency order has expired. But again, I guess my point would be, back in August, when we were looking at these expectations and these protocols going into the school year, we were planning to move forward requiring masks. And with infection rates today being worse than they were in August, I just don't think now is the appropriate time to peel back any layers of those mitigation strategies. And so I just, I don't support this decision to start as early as November 29th. I feel like we should, I'm excited about the idea of removing some of these mitigation strategies, but I think we need to look at transmission rates. And the transmission, I pulled up the website for the department. Oh, I've got it jotted down here somewhere. The Wisconsin Department of Health Services has a breakdown of data by school district. And so I pulled up the Oregon School District just to see, and in the Oregon School District, it's 184 cases per 100,000. That's as of November 22nd. So I just feel like it's too soon to start having that conversation. I think the drawbacks of peeling back the masking are too high as it relates to the increasing the number of close contacts, increasing the number of kids who are going to quarantine. This is in the exact opposite direction of our goals, which is to have safe in-person learning, keeping students in school with minimal disruption. So more quarantines means less students in person and more disruptions to their learning. I feel like peeling back something when we are in a high transmission or a very high transmission is the wrong timing for this. I also think that this will have an impact on staff. The more quarantines and the more contract tracing we have, the more impact that has on our nurses and the staff that are already taxed with devoting their time to this task. So I'm concerned about that. I'm also concerned about the additional work it may cause for our teachers or shortages with staff. This does not support the mental health nor manage the stress level of our staff, in my opinion. Again, I think it's good for us to have these conversations, but I think we're just too soon on removing one of these mitigation strategies. So at this point in time, I don't support this motion, and I think that it's too soon for us to be pulling those back.
All right, thanks, Anna. Anyone else with discussion? Mary, go ahead.
Yeah, I think our conversation is premature. As Leslie pointed out and as Anna just mentioned, our cases are on the rise. And Thanksgiving historically is a time that respiratory viruses really take off. So we are heading into cold and flu season. It doesn't make sense to me to be peeling back a layer of our mitigation if our stated goal is to keep our students in school. I also, I think our lessons learned really speak to our need to keep them in school, to keep their students in school, and to keep our teachers healthy and well and in school as well. We already don't have, as Anna was talking about, we don't have the sufficient staff. Our substitute pools are extremely limited. I know it's a nationwide issue. It's something that we have, as a board, been talking about quite a bit. But we need to make sure that we are not overtaxing our system because we want to keep our kids in school. I think that also the 2 weeks, or the 7 days actually, after our winter break is too little a time. We need to allow for 14 days in order to see case rates go up. And we do know that masks work. We have data showing that they do work. So we need to really reconsider what we're talking about. I am excited as well to talk about time for mask removal, but I don't think that time is now.
All right, any further discussion? Tim, go ahead.
Thank you. I put a lot of thought into this as well, and I have tried to educate myself. I know that data is very important to us. Making decisions around data is very important to us. And so I started with data as a priority. And I want to reflect on one study. Mary, I know that you mentioned that we have data that shows that masks work. The CDC did their own study, and many of you must have run upon it with regards to COVID and transmission rates and the layers of activity that we can use to mitigate that transmission. In May, the CDC had a study with 90,000 elementary student kids, 169 Georgia schools, about a year ago, from November 15th until about December 11th. And I was reading a number of articles about that study because it's interesting that in that study, the summary of that study left out some very important things. And so I want to read just briefly from one of those articles to highlight what was in that study summary and what wasn't. It said at the end of May, the Centers of Disease Control and Prevention published a notable yet mostly ignored large-scale study of COVID transmission in American schools. A few major news outlets covered it, but for the most part, it was overlooked. In the study summary, it stated that masking then unvaccinated teachers and improving ventilation with more fresh air were associated with lower incidence of virus in schools. Those are common sense measures. We can all agree with that, and we have spent significant time and resources doing those things. We now have a staff that's nearly 100% vaccinated, and every one of our schools has had our ventilation notched up, and some significantly, and I think Andy could speak to that. Other findings, equally important in the study, however, were absent from the summary and were not widely reported. These findings cast doubt on the impact of many of the models, including classroom barriers, HEPA filters, and most notably requiring student masking. Those were each found to not have a statistically significant benefit. In other words, these measures could not be said to be effective. Could not be said to be effective. So, I'm reading from our national data source, over 90,000 elementary school kids, that masking is not effective, and yet we're requiring it. That's my first point. And that's just one element of data that I'm using to make my decision. Secondly, we rely heavily on key data sources. In particular, the CDC and Public Health Madison-Dane County. Both of the highest sources we use to make this decision, beginning November 27th, for us it would be the 29th, are strongly encouraging masking and not requiring it. I totally support that. I totally support what CDC and PHMDC are supporting. Strongly encouraging masking, not requiring it. Third, we've spent a lot of time in the visioning committee talking about Portrait of a Graduate, a lot of time talking about that for months. We place a high value, not just this board, but our educators, our community, and our parents place a very high value on critical thinking. The ability to sift through data, understand what it's saying, and make a value-based decision on truth. That's important to me as well. That's exactly what we have to do. So we're looking at data from the CDC. We are looking at what do our key sources of information telling us, the CDC and PHMDC. And finally, this district prides itself on options, providing options at every turn. Options in our athletics, in our arts programs, our music programs, our homeschooling programs. Options to get education beyond high school while in high school. We are option driven. And it's very important to this district, and it always has been. This is another one of those options. It requires a decision. I totally understand that. But because of that, I am supporting an option. As many have said, I like the phased approach too. I absolutely do. And I'm satisfied with the 7 through 12 beginning November 29th and K4 through 6 after school comes back after the holidays. The data has evolved a lot, and we're hearing from people that we trust, like the CDC and PHMDC. And it is all telling us that masks should be optional. It gives people who want them, who feel it's important, to wear the mask. And for those who don't, they don't. They know what they're getting into, and they know what the requirements are in terms of quarantine, but it's a decision, an option we are providing our students and our parents. And so I support the motion that's on the table.
Great, thank you, Tim. Any further discussion? Troy, go ahead.
Can I go? And I'll just start by saying, Tim, I clearly read CDC guidance differently than you about the effectiveness of masks. As I read CDC guidance, they state that it's the second most effective measure just behind vaccinations. But I want to go on. Keeping kids in school with minimal disruption, that's really what's most important to me and what we've said is most important to this district. I've spoke with several students about this matter and about how they feel about wearing masks in school, and I'll just tell you that almost without a doubt, the students that I've spoken to would much rather wear a mask and stay in school than run the risk of having to stay home for 7 to 10 days, whatever that would be for quarantine. That period of time where, as we all know, that period of time when our kids were at home and not in school, it was very, very difficult. And that's what the student that I spoke to, who most eloquently said this, that's what comes to her mind is that period of time where she was at home and couldn't go to school. It was a terrible time in her life. And to her, wearing a mask is a small thing to do to minimize the risk of having to stay home and not be in the classroom. So that's number one. I've also communicated with some medical professionals that I have a very, very high regard for, and they are strongly encouraging me to prioritize student health and to follow health guidance while we're in this high category of community transmission. And as I said, I hold these individuals in very, very high regard. They're working in medical environments. They know. I believe what they're telling me. with all that being said, I am still glad we're having this conversation. I am ready to move forward with discussion of moving mitigation layers. There are some components of Kevin's motion that I do support. However, there are some things that I'm just not supportive of. So starting on 11/29, November 29th, I would be supportive of the proposal to remove masks for the co-curriculars for active participants. I think that's something I would support, and I see that as a first step as we're talking about phasing things in. I would see that as one of those layers that's peeled off, but I would like to give that some time before we take the next step and go on to removing or making masks highly recommended in the classroom. I feel like also we saw the data on the vaccine clinics. So 22% of our students will not, of our K-6 students will not be fully immunized until late December. So by my calculation, that would be December 24th. And that's important to me because of the household transmission that we know happens as students have siblings that are unvaccinated. If we were to peel back the layer at 7/12, then we have that potential for household transmission. So I would like to allow sufficient time or more time for K-6 to be fully immunized. And then I would also say I support what Heather had discussed about separating out 7/8 from the 9/12. So I feel like when we go forward with 9/12, I would like to consider another layer of a 7/8 and then a K-6. So I think that's where I stand. That's my points. So.
All right, just one clarification. Leslie, can you clarify what Public Health Madison-Dane County's recommendation is? I want to make sure that we're clear on that in terms of the order, but then they had another recommendation. So
it's an important wording distinction.
So there was the health order that releases masking, but then they also had a statement that said they strongly encourage universal masking in school districts. So I just want to clarify that people are clear on what Dane County Health did say. Tim, go ahead.
So we talked about, I'm hearing the words "not yet." We're not there yet. I want to know where there is. If we don't accept this motion, I want to know specifically where there is. I want to know if that means everyone's vaccinated. That will never happen. I want to.
Can I respond to that?
Just wait, Anna, just wait. We'll let you go after Tim is finished.
Absolutely.
I want to know if that means when cases fall to a specific number, below a specific number, because we've heard those numbers. We've heard 70% vaccinated. We are in Dane County. We are well beyond that. Well beyond that. I have heard, we're rising in cases. Dane County is without exception across the state the lowest transmission area and the highest vaccinated area. And yet, we're not there yet. I just want to understand, where's there? Will we ever get there? And if it's about 100% vaccination, these will never go away. So where is there?
Okay, Anna, go ahead.
Well, I guess where I'm at with that question, Tim, is I've got a couple of things in my mind that I feel like would be a more appropriate time to start pulling back some of these layers. And the first one, I guess, in my mind is the transmission level not being high. So I guess I'm looking at, I guess I would call it moderate to low as a starting point to start to pull something back. Because I think at that point, we've got a lower exposure in general in the community, and that's going to lead to lower exposure within our schools. So that that is a metric that I would be interested in looking at or be more comfortable with. The other piece that I guess I'd like to mention is that, we talked about these broad points of data that we're looking at and all of these various health agencies. Every single one of them is aligned. And I'm glad that we asked for that clarification, Krista, because the CDC, their language, I went to their website today, they recommend universal indoor masking for staff, students, teachers, and visitors, regardless of vaccination status. Public health has the same language. Consistent and correct mask use for all teachers, staff, and students in schools, regardless of vaccination status. So they're not saying that they strongly encourage. They're saying you should continue with your universal masking. My thinking is that if there's not alignment within these agencies, that's another factor to me, that we have another, some health expert that's saying, hey, you know what, this isn't, we're not recommending universal masking. And, that's another, I guess, point that I would be interested in considering that. So those are kind of the two things, in my opinion, as well as, I guess monitoring the vaccination rate of our K through 6 students and collecting, more information and data as it relates to that. So that's kind of where I'm at. I'm not comfortable moving forward while we are in a high or very high transmission in the community.
Okay, Heather's first, and then Kevin, then Mary.
Tim, I appreciate your comments, but I don't understand them because where there is what we're talking about. I just don't agree with what your motion is, and I laid out their timeline in terms of what I was thinking. I have a hard time with us continually saying that Dane County is the lowest in transmission, and Dane County is the only, one of the strictest mask wearing, counties. So that seems to line up. Why is it low in transmission? Probably because we're one of the only ones wearing masks. So, I everybody can make the narrative fit what they want, but here's where it's at. It's not a personal reflection on personal choice. This isn't about, do my kids like masks, or do my kids have acne, or what somebody else's kids say. Well, that's all valid, and I appreciate it. This is about making a decision for all kids. And if we have sat here and over and time again said, what is Dane County Public Health, or whatever the too long of an acronym is that I should know by now 18 months in, if they're saying that the mandate is ending, even though they're universally recommending, then that's where I have to go with it, and that's why that date is important. It's hard for me to find another date. What are we doing then if we're not starting that process now?
Heather, sorry, what date?
The 27th or whatever, when their mandate ends. We're starting, right? Yeah, sorry, 29th. So, but here's the thing. I'm also going to be the next person that if Dane County says, on December 15th that the mask mandate is back, then I'm going to be the person saying we're going back to mask mandates. It's that simple to me. It's not a personal choice. It's that I'm looking to the most local public health experts that we can, and that is the end of it for me. It's not about, we can't have it both ways. We can't sit here and for months have, people have said, well, don't listen to Dane County Public Health, and now we want to listen to them. And then if they say it again, are we going to listen to them? It's either we are or we aren't. And for me, the biggest difference to what Anna said is in August, if we maybe didn't align at that point, I'm not clear, but is the ability for kids 5 and up to be vaccinated. So I just wanted to add a few more thoughts about this. I'm still a no for your amendment or your motion, Kevin, but I do have a there in mind.
I think it was it Kevin and then Mary? Sorry.
Yeah, I just want to address the August comment that was made by Anna. I mean, to me, that's immaterial because that was half the amount of time that I quoted in terms of time to get vaccinated. So the decisions we're making in August don't necessarily have to align. We're making with decisions that we're making now with much more data, much more examples of school districts around the country, around the state. And I guess shame on us that we haven't learned from some of these districts and gotten information in terms of how they're doing with the path we want to go down, because we've had ample time to do that. On the whole topic of November 27th with mass strongly encouraged while actively playing or performing during optional events, trust me, I'm 100% on board with that. My son played in a tournament a couple weekends ago with 18 teams. We were the only team that wore a mask. Trust me, when you play basketball, it's almost impossible to keep your mask up. It's a show. It's a show at the end of the day, okay? Let's just face facts. It's a show. So I'm totally on board with that. But it also doesn't align with having different dates. So sitting in a classroom is going to be different than playing basketball or wrestling. That's just illogical. Trust me, I want that to happen, but it's also illogical, and we got to use logic here. That's what's been missing through a lot of this. We've had ample time, like I said, to learn from different districts because they're dealing with the same quarantine rules we are if they're properly following CDC, and I'm sure they're having the same staff shortages we're having. I'm promising you that if there were significant episodes of children missing school in this state, you'd be hearing about it from most of the media. I promise you that. And it's not happening.
Go ahead, Mary.
So, Tim, I completely agree. We're never going to get to 100% vaccination. We're not going to get in adults. We're not going to get it in children. So that can't be out there. I mean, I think that was your point. But I do believe that we need to give our younger learners the opportunity to get vaccinated. I think, as I mentioned, you know, we're just heading into the uptick that seasonally we always see an increase in respiratory viruses at this point in time because of the holidays. And so from that perspective, it doesn't make sense to implement this immediately after the, and I do want to clarify a little bit, the executive order mandating masks is being allowed to expire, but their recommendation for universal masking in schools is not going away. That is, and that was why I had asked Leslie if she had any inside information based on her conversations with Public Health Madison-Dane County. And so it just doesn't make sense to me that we would go into what we know is going to be a high transmission time and peel back our layers then, when we know then we're putting our students at risk of missing school or being remote, and we know that we're putting our staff at risk of missing school and being remote. And the one other portion of the here that I wanted to raise with this group is there are currently 3 drugs that are being evaluated by FDA for the treatment of COVID. And I do have hope that on the horizon, we will be able to go mask-free in the not too distant future.
Is there any further discussion? All right, hearing none, Katie, can you call the roll? The motion is to go mask optional for grades 7 through 12 starting Monday, November 29th, and then mask optional for grades K through 6 on January 10th. Is that correct, Kevin?
Mask encouraged.
Sorry, mask encouraged. Okay.
Important qualification, right? Sorry. That's okay.
All right, that is the motion. Katie, can you please call the roll?
Mr. Mehring,
Yes.
Mr. LeBrun,
Yes.
Ms. Bijak,
No.
Ms. Garrison, Dr. Lakuda, Mr. Pankratz, Ms. Flanagan.
No, motion is defeated, 5-2. We can have another motion on the floor, or if we do not have a motion on the floor, we continue with current guidance. So I'll open up the floor for a new motion.
Can I ask a question? What, if we don't change anything right now, what would happen about the last statement there, beginning November 27th, masks strongly encouraged while actively playing?
We would just use that, we would make that an administrative guideline. Sorry, I keep forgetting that. We would make that an administrative guideline within the 565 and 566. And we would maintain, because prior to the mask mandate, we had made the decision to become a mask universal environment. So we would maintain without any changes. Other than the exemption for actively playing or performing during optional events.
So just to be clear, you would revise the administrative guidelines to allow that exemption?
Yes.
Okay. And we don't need to act on that. Is that clear?
Go ahead, clarifying question.
Clarifying question. So that's the only thing that would change in the administrative guidelines. The rest of this would just be for further discussion and review at the next board meeting.
So what we would do, we would continue with that change. That would be an administrative guideline. We would continue with our current environment until the next board meeting, which is December 13th, where that could be, we could put on the agenda again, policy 565 and 566, unless someone else wants to make another motion.
Got it, thanks.
Krista, so these recommendations would not go in effect? What would be in effect is what's in the guidelines right now, which is no change until we have another board meeting.
What they're saying is the administrative, they have, right now with our policy, they have the administrative latitude to change the bottom one, which is masks strongly recommended for play. Unless you want to make
Sorry,
a motion,
maybe
that
I
would
need
not.
to maybe I need to simplify this for my little brain, but this is the policy we're going to be following that's been proposed.
No, no.
Right.
No, the board has not acted, so the land stays the same right now.
Right.
So if someone wants to make a motion that says we move to this environment as it's written, or somebody has another idea for a different motion,
Yep.
they can put that on
Yep.
the floor.
I just
If
wanted to
not,
clarify.
we are staying mask required until the board makes another motion and acts on that. Yes. Go ahead, Kevin.
I'd like to propose a motion to adopt the moving forward policy adjustment that Leslie has presented tonight that's on our board right now.
So your motion is that masks would be strongly encouraged for all students and staff starting January 18th. So I would say you need to make a motion, Kevin, because there are two things on here. Masks strongly encouraged January 18th, or if a phased approach is preferred. So you would need to make a motion indicating what you'd like the board to consider.
Oh, okay, yeah, thank you. I'm sorry, I didn't see the second bullet there with the different options. So my motion would involve 7 to 12 masking encouraged by January 10th and K through 6 by January 24th. So it'd be a phased approach.
So
As recommended by the administration.
Okay, so the motion that you are making is that you would like to have the Oregon School District go mask strongly encouraged for grades 7 through 12 starting January 10th, and then strongly encouraged for K-6 by January 24th. Is that the motion that you're making?
Including the beginning November 27th mask strongly encouraged while
Okay.
actually playing.
Okay. Is there a second to that motion?
I'll second that motion.
All right. Floor is open for discussion. Go ahead, Heather.
I'll keep it brief. I'm not opposed to Part A of that, the phased approach, 7 through 12, January 10th, and K through 6, January 24th. I struggle with having the optional events not align with sitting in school. I understand it. I see I understand masks are slipping down during basketball games, and I get that from a logical perspective. It just seems really like a slippery slope to say, yeah, go do this outside of a school-sponsored, district basketball team, and then but when you come to school, you have to do that. It doesn't sit well with me. So I just want to throw that out there for discussion. Maybe somebody can shed light on how they can see it differently.
Is that a question to Dr. Bergstrom?
Nope. Was that where we were with questions? I'm sorry.
We have a motion and a second, so we're open for discussion.
Yes. Have we ever done that? But thank you, Krista, sorry. Have we ever done anything that you can recall that we, don't have the same rules and guidance for optional sports than we do in the classroom?
Oh, I'm sorry.
No, not that I can recall. I mean, it is, there's, the logic would be to have everything students do under the umbrella of the Oregon School District be treated the exact same way. And honestly, they're probably, if you think about transmission, they may very well be safer in the classroom than they are breathing heavily on the basketball court. But when you also examine that through the lens of what is a required piece and what is an optional piece, as far as participation, that's when you can begin to make the distinction. And, it's also important to note that our students, if we did not do the optional or masking during optional events, may be the only school in the conference that would be required to mask.
Go Go ahead, Kevin, and then Tim.
Yeah, thanks for that clarification. I wanted that to be known too in terms of what's being done in the conference. There are aspects to it that are illogical. I've stated it myself, but the fact that it is optional, people do not have to attend. So that makes it, I guess, okay. Obviously, I put a motion forward to be a little bit more aggressive, but this is potential fallback. So,
Tim, go ahead.
I can appreciate your point, Heather, that when someone says go, we all go. But I can also appreciate getting past the holidays and being safer past the holidays. We got a couple of extraordinary family get-together times and traveling times ahead of us. I can absolutely appreciate getting past the holidays. And it does help to clarify optional events as the trigger that gives us comfort in allowing that option sooner. So I would support that.
Anna, do you have any comments or questions or discussion?
Yeah, I guess my concern with this is I think it's, the dates to me are arbitrary, to be quite honest, because again, I just feel like we need to couple this with the rate of transmission. So if transmission is still high or higher than it is today, I just do not think we should peel that back. And if we start on January 10th, we don't give ourselves a board meeting post the holidays to review data or understand where we are with transmission in the community. And so I don't really like those dates. I guess so I'll just say that, and I'm sure no one is surprised by that. I will say that I'm agreeable to the second portion, the optional piece, being a mask strongly encouraged environment. And the reason that I would be comfortable with that is, let's just say we have, our basketball team is playing basketball and they're on the court. At one point in time, you've got 10 players that are unmasked. I guess I don't know what the expectation would be on the sideline. I guess my preference would be put your mask on your sideline. I don't know. I mean, maybe that's ridiculous. But my point is, if it's 10 people on a court and they're unmasked and they're being physical and they're playing their sport, those same students who may have, had that exposure during that game, now they're going to go into their classroom environment and they'll be in a mask-required environment. At least that would be the case for the month of December, let's say. But again, I guess I'm more comfortable with a mask optional or a mask strongly encouraged for our optional activities, because as families, we can all decide whether we're going to attend that basketball game or have our child participate in that particular optional sport. But I don't necessarily, if I want masks to be worn and I'm comfortable, or I'm not comfortable with a mask optional environment, I don't want families to feel like they shouldn't send their kids to school. So I feel like that's just a different category than an optional event.
Anna, just one clarifying point. It says beginning November 27th, masks strongly encouraged while actively playing or performing. So our understanding is that when kids are sitting on the bench, they are masked. Is that correct, Dr. Bursom? Okay, yes, she says yes. So that's just a clarifying point to your question earlier.
I do have another question about the optional things. What is the expectation for organizations that use the school buildings? For example, community events might be held at the Performing Arts Center. If there's not an emergency order in place, but we have an outside entity that is using our school for one of their events, what is the expectation for those outside agencies?
During active play or performance, that's when masking would be strongly encouraged but not required. All others would be required, similar to what the rest of us are doing within the buildings.
Thank you for that clarification. So I guess I can support the second part of that. I really am not comfortable tying ourselves to dates in January when we don't know what transmission is going to look like and we don't give ourselves a board meeting to review that.
Do you have any friendly amendment that you'd like to propose, or are you just stating your opposition?
Well, I guess I would offer a friendly amendment, and that would be that we implement this strategy assuming transmission rates are in the moderate category per CDC and public health guidelines or statistics, or I guess, I don't know what you call it, categories.
All right, Kevin, you're the maker of the motion. Is that friendly to you or no?
It's not.
Okay.
It is not because, and I got to state why, because there's multiple school districts that are high or very high and are not having quarantine issues around our own state, so I can't accept that.
Anna, do you have any other questions pertaining
No,
to the
that's
motion?
it.
Okay, any other questions pertaining to the motion on the floor? Mary?
So, yeah, we're getting much closer to where I'm going to be comfortable with what we're talking about, but I would much prefer to see 14 calendar days after return. So that would put us at January 17th rather than the 10th, 18th.
It's a holiday. I think 17 is MLK.
Oh, okay, thanks. Yes. So January 18th, that would give us the opportunity to review transmission rates, review what, what our options are at the January 10th board meeting. Plus, it would also allow for case rates to stabilize after the holidays.
All right, any further questions or discussion on the motion on the floor, which is masks strongly encouraged for 7/12 starting January 10th, and masks strongly encouraged for K-6 starting January 24th, and then beginning November 27th, we strongly encourage, masks are strongly encouraged while actively playing or performing during optional events. Okay, go ahead, Heather.
Okay. So, Leslie, in this moving forward in the phased approach bullet, is your reasoning that it's January 10th and January 24th solely because of winter break?
It is. We thought the January 10th date would allow us to pick up any cases that resulted from holiday travel. Mary's right, 14 days is probably the most, but we thought January 10th was sufficient.
So, is it fair to assume that if we were in September and all things the same, that you would align with Dane County Public Health for their end date? I'm trying to understand what the magic part of this date is, other than the winter break. Like, if winter break didn't exist, would we be recommending a sooner removal or a sooner moving to strongly encouraged, at least for 7 through 12? I understand the K-6 vaccinations rate.
Understood. Winter break certainly is a factor, because we know that that was when cases spiked last year, and we can expect something similar. Perhaps not as strong because we have so many people who are vaccinated, but we can expect something similar. I think the other case, or the other issue, is simply that we're going up and not down in cases. And so that is why we don't want it to result in more outside community cases are reflected in our schools. Without universal masking, there'll be more cases with more quarantines, more kids missing school. And that's okay if community transmission is low, but it's not. So.
Go ahead, Mary.
Sorry, I have another question. So we're talking about these options, but not keeping in mind what our policies state. And so I'm wondering how we align what we're even talking about with a phased approach to what our policies tell us we need to be doing.
Would you like me to address
Go
that?
ahead.
Okay.
Go after you.
We could easily add a sentence to the policy that states that as of this date we will be. But I also think the policy is written in a broad way, so that we're able to take a look at broad data points using multiple forms or multiple areas of expertise to make our decisions. So honestly, I don't know if anything here, in my opinion, it requires a policy change. However, I can certainly understand someone on the board wanting to be more explicit in the language that's in that policy.
What I will state is that the policy states that's how the board will make the decision, is using broad data points. My preference would be along Anna's, that we state what those data points are. The other option that is, you can vote in favor of this motion, and you can also vote to reconsider at a next meeting. So we could call a meeting if things change and we feel like that's not in a line, that we could have a special meeting to do that. So those are some options available to you if you vote in favor of this motion, or you can vote that you don't support this motion based on how it stands.
Krista?
Point of clarification here. And I apologize if I missed this. But if we, I like that idea, and I'd like to, I guess, maybe make a motion to defer this decision, maybe into December. But I don't want to lose sight of the optional activities being a strongly encouraged mask situation. And so does that specific piece need board action to implement an administrative guideline effective November 27th that moves to a strongly encouraged mask environment for the optional activities?
No, we already discussed that. That last part is an administrative guideline that if the board did nothing tonight, that the administrators could make that recommendation.
Okay.
So the motion on the table is Kevin's motion, which is, as it stands, 7/12, January 10th, masks strongly encouraged, case 6, January 24th, and he includes in that the beginning November 27th as part of his motion. So that is the motion on the floor, and we can vote on it on its merits. And he did not accept that as a friendly amendment in terms of your specific data points. So that is the motion on the floor.
Yeah, I want to make clear that November 27th and optional activities is part of the actual
Yes,
motion.
correct.
It's linked together.
Yes. So any further discussion? Hearing none, Katie, please call the roll.
Mr. Mehring?
Yes.
Mr. Pankratz? Yes. Ms. Bijak?
No.
Ms. Garrison? No. Dr. Lakuta? No. Mr. LeBrun?
Yes.
Ms. Flanagan?
Oh, thank you, everyone. I will vote yes. Motion carries 4-3. Moving on. So administration has guidelines as effective of the board tonight. We do have a meeting December 13th. That is another opportunity. So moving to D, discussion items. Number 1, committee reports. Policy, Anna. All right, thank you, Anna. Vision steering, Troy.
We did not meet since our last meeting, but we do have a meeting scheduled at the beginning of December. 2 agenda items, portrait of a graduate and continuation on our facilities study discussion.
Great, thank you, Troy. Tim, Worth Woods. Great, thank you, Tim. New to the committee reports tonight is Wellness Committee. Heather, so you want to give a little background so everyone knows what the Wellness Committee is, and then you can report on what they reported on.
I will be glad to do that at the next meeting, but the first meeting that I'm actually attending is next Tuesday, the 30th at 5 o'clock. So that is my update for this time, but I will definitely give a more robust update and description at the next board meeting.
Great, thank you. Sorry, I jumped the gun on there a little bit. All right, moving on to E, information items. First is vision and strategic planning. I'll turn it over to Dr. Bergstrom for the next 3 items.
Thank you. We don't have a lot of additional information to report on our visioning and strategic planning component. You've all seen the framework before and know what phases we are in, that we're working on the decision-making model as well as the portrait of a graduate. We have made some excellent progress in getting feedback and input. The input from the leadership teams is rolling in, and it's really interesting to see because it aligns very much from the feedback that the policy committee gave just very recently. So it's good to know how aligned we all are and what we want for our students, because I think that will make the implementation of Portrait of a Graduate much more successful, knowing how well aligned we are already. So as you can see, we are, policy committee already started the discussion on this. And then we're moving forward with the feedback process. So it's going to be interesting to report back on what everyone has to say. So as far as our teaching and learning update, we talked about how interconnected our system is regarding teaching and learning, the mental health and wellness of our students, and then ensuring that our students and staff remain healthy. And those are the types of policies that we were just discussing. So one update under teaching and learning is the fact that the school district state report cards came out. And they are different, it's a different scale, and it has different points of measurements that have been used in the past. Consequently, it's challenging to compare it to previous years. However, you can see that as a district, we remain in the exceeds expectations category. We've always been realistic in how much the DPI state report cards are actually able to tell us about what we are doing for our students and how well we are preparing our students. They certainly give us some information, but they also aren't able to measure some of the things that we know that we have said in our Portrait of a Graduate are exceedingly important to us as a community. So while we're always pleased to exceed expectations, we know that this is just one small portion of the story related to who we are and what we want for our students. We did very well in achievement. We did very well and on track to graduate. And we know that we want to improve in growth for individuals and in growth in some specific targeted groups, such as students with disabilities would be one example of that type of targeted group that we want to be able to do what is necessary to see them grow even more than they currently are. So I don't know if we want to take questions here or just move to the superintendent's report.
We'll open it up for questions. Any questions on visioning, strategic planning, or teaching and learning update? Go ahead, Tim.
So why is it a different scale?
Because they're constantly updating what they are measuring from us and trying to make it something that is more of a valuable tool to all of us. For instance, it used to be something called the Closing the Gap measure, and now they have, through data, identified the groups that each school district should be paying close attention to, and they're measuring on those specific groups. So they're trying to make it a more useful tool for the school districts and also give it more breadth. For example, part of the report card is now the number of arts classes that are included in every school district. And you know we'll have an excellent score. However, it doesn't necessarily influence the score, but it's on the report. It's not on this report because there was a data upload failure when they were uploading our arts courses. However, we know that's an area of strength for us, so we're excited to report on all of that. So basically, they're trying to make it a more useful tool for school districts.
Go ahead, Kevin.
Yeah, follow-up question. I'm sorry, you done, Tim? Follow-up question. How often have you seen in your career DPI change the scale for their categories?
Well, they haven't done this for very long. I think this is something that they've only done for about 7 years. I wonder if anyone can verify that for me. But they haven't done this very long. So
But it's the first time in 7 years you've seen them change the scale and lower the standards?
To the best of my knowledge, I don't know if it went down or it went up.
It went down across the board. Usually.
One category went down and one went up.
Yeah.
Any additional questions, Kevin? Any other questions for Dr. Bergstrom? Okay. Superintendent's report.
I should just note that the changes here were a long time coming and weren't pandemic related. Just so you know, they were working on adjustments to the report card. It wasn't just because of the pandemic. So for our superintendent's report, the first thing we want to address are some of the resources we have for our families on OregonSD.org/talk. So a few weeks ago, there definitely was a lot of social media activity related to things happening at the high school and about a website in particular that's hosted outside of our country and the investigation into that particular website. So as you've heard from communications that I've sent out, that we were first notified that this website existed in September, and we immediately notified the police. The police conducted an investigation and contacted the parents of the students involved. One of the unfortunate pieces that was discovered is that it wasn't something that the police department or the Department of Justice was going to be able to just take down. However, by November, we realized that not only was the website still there, but it was there and it was, it had even elevated in its level of threatening messaging and general obscenity. And that's when it was shared again with the police department. They had not closed the investigation. They just hadn't been able to shut the website down. And because this was on social media and it had increased its level of threatening and obscenity, that's when we decided that it was time to send out a message beyond the message that was already sent to the parents of the families involved. Because we wanted to make sure that people understood what was happening. And you know, that is a very challenging decision to make, because you know that when you put it out to the general public, you're also driving traffic to the site. And that is something that you never want to do if it's at all possible, because should be about protecting the people who are being victimized by the sites and are now, you know, basically survivors of having had to experience that type of invasion of their privacy. So you know a little bit more now too that the investigation continues, and our focus now is on how to make sure we're supporting our students. So not only are the students who are directly impacted by the site involved in circle group counseling, and their parents have come in for meetings with the police officer and the administration, but we're also taking it a step further. And I'd say a lot of this goes to the great leadership at the high school, and that's the adult leadership, but I also have to say the student leadership, because they've been pretty wonderful about coming together to work alongside Mr. Pleiner and his team to help everybody at the school understand the impact of sexual harassment, because that's really what we're talking about related to this particular website, sexual assault, and issues around consent. And that's very aligned with the Dane County Youth Assessment data that we've all seen in the past several years too. So there was an assembly today, and students worked side by side with Mr. Pleiner, his team, and student services to plan it out. And Mr. Pleiner opened up the assembly for grades 9 and 10 with his own comments. Students from the Imagine group, which is a group promoting education around sexual harassment and assault issues, they presented information. Some members of the staff from the Rape Crisis Center presented information for students, so they all knew what their resources were if they or any of their friends had ever been victims of sexual harassment or sexual assault. So tomorrow's assembly is for grades 11 and 12, and it's really just the beginning of ensuring that we're continuing the conversation, because this is something that we really need to do as much as possible to eradicate from the experiences of our kids. Whether it's happening in schools, in the communities, or online, it's impacting them negatively, and certainly impacts their ability to feel safe and to learn in school. So we need to continue to push forward and make sure that we can make a difference in that. And honestly, when you listen to our young people talk and you hear their passion and their level of knowledge and commitment already at this age, you know that we are going to be able to make a difference. It's very inspiring. So I just wanted to make sure that you knew that there's a lot happening. And we have resources for our families who want to find out how to talk to their kids about all of these topics. So I encourage people to go to the website and take a look. On a lighter note, congratulations to the OHS swim team. They participated in the state meet on November 13th. So we have Claudia Shorts and Haley Siren and Noelle Marsh and Catherine Dunn. Nice job to our swimmers. Great work. I don't know how many of you saw this, but this was, boy, was it ever a touching and inspiring video series on Oregon life, featuring one of our students, Giordano Zielinski. And it was, as I said, a 2-part series, and it is heartwarming. So I would encourage anybody who's interested in what determination and love looks like, take a look. And in addition to that, we've had our other students featured on Oregon Life in the past too. Britta Baldus and Andy Pollock and Dakota Brown and Brandon Thorne. And they were showing the ways that they are building businesses as young people who are Oregon high school students. So take a look at the Oregon Life component of OCA, because there are some great stories about our students. It was School Psychologist Week a couple of weeks ago, and we have quite the wonderful team. So you can see Hannah Grinke and Kelsey, and she's got a new name, and I want to make sure I can pronounce it correctly. And Tonowich. I'm going to say it the wrong way. Kelsey, I'm going to have to apologize in person to you tomorrow. So Kelsey's at Netherwood. And then Sophie Gilfus, who's at Prairie View, Jen Casperson at Forest Edge, Sarah Hughes at RCI, Rachel Hansen at OMS, and Jordy Peter Schmidt at the high school. A wonderful team. My niece is going to school to be a school psychologist, and I am her cheerleader on this because we need more of these wonderful and talented people. Congratulations. Speaking of wonderful and talented, congratulations to Rebecca Krenz. She won the New Teacher Award from the Wisconsin Association of Foreign Language Teachers. And if any of you have met Rebecca, because she served in multiple roles in our school district and is a former student, you'll know that she is pretty outstanding, and we're really lucky that she decided to make her or start her career here. Then we have our OMS Honors Band. They were competing at Sun Prairie a couple of weeks ago. So congratulations to them for taking that big step. And then we had a whole bunch of Veterans Day celebrations. We had ways throughout the district that students were learning about and honoring the people who served their country, and how much respect they are due for the work that they are doing and have already done on behalf of all of us. So many thanks to our veterans, and I'm glad our students had the opportunity to thank them also. And then a thank you to our volunteers. In the center, you see one of our students, our little guy, who's in the waiting area after his vaccination. And, you know, he wasn't very happy a few minutes before this picture, but he was very happy by this point. And you see all the fantastic volunteers, the pictures of them surrounding him. You know, it's really symbolic of the way we all come together to make sure that our kids get what they need. And that is it.
All right, thank you, Dr. Bergstrom. It's really great to see the breadth and depth of things that are happening in our school district. Fabulous. Okay, moving on to F, closing. Future agenda. We do have a meeting on December 13th. And so if you have something that you would like put on the agenda, please let me know in writing. Otherwise, I think we'll be looking at potentially some things from policy and some other items that we'll put on the agenda. Now moving on to checkout. I will go around the room. Anna, we'll start with you. Anything for checkout?
Nothing from me, thank you.
Tim?
Nothing for me.
Kevin? No. Mary? Heather? Troy?
Just a note for me, we're going into executive session after this meeting, and I will be recusing myself from agenda item number 2, which is negotiating on the Oregon Education Association contract, because my wife has a contract here.
Great, thank you. So as Troy mentioned, the board will now be consideration of moving into closed session, and we'll be conferring with legal counsel about pupil investigation pursuant to 19.85 1G and 118.1252. And then the next item for closed session will be discussion regarding negotiating the 21-22 collective bargaining agreement with the Oregon Education Association pursuant to Wisconsin statutes 19.85 1E, and conferring with legal counsel about the negotiations pursuant to 19.85 1G. The board may reconvene in open session to act on any closed executive session items if necessary and applicable. So we will take a 5-minute recess, and then we will go into closed session.